Let's talk about narrow angles. Inside of the eyeball, I like to use the analogy of part of the eye making fluid like a faucet that's on, and another part of the eye, again, inside of the eyeball that's draining that fluid. And the balance of these two things is what makes your eye pressure. The drain we can think of is the angle in the eye. So you'll hear this term narrow angles. And narrow angles means that the drain is not closed, but it's crowded, for lack of a better term. And it's at risk of closing. If it were to close, there's a few things that would likely happen, and you have to memorize these things if you're a narrow angle patient, because if this ever happens and it's not addressed quickly, this can be blinding. So if the eye pressure shoots really high really quickly, you're going to get a weird type of headache, almost like a toothache pain around the eyeball, different from other headaches, with nausea and blurry vision. So blurry vision, feeling like you got to throw up, and a sudden severe pain around an eye means call us even on a Saturday, and we need to evaluate it promptly. If someone has narrow angles, there's two kinds. You can just be a little bit narrow, in which case we just watch it over time, and there's really nothing that you have to change. And somebody who is at a significant enough risk where that drain might close on them, we address it in two different ways. So if that person or patient has a cataract and that cataract's affecting their vision in a meaningful way, then cataract surgery is pretty much inevitable for most patients, and it happens to kill two birds with one stone here, because when you've had cataract surgery, it helps open up space and really opens that drain structure up. Sometimes we'll do cataract surgery with this kind of small, gentle pulling procedure on the iris, the colored part of the eye, that helps open that drain further. So cataract surgery is a great option when somebody's having some vision complaints related to their cataract. If someone's not having vision complaints related to the cataract, or they really don't have any sort of meaningful cataract, then we do a laser procedure in the office, and this is called a laser peripheral iridotomy. You don't have to remember that phrase. There's a lot of different glaucoma lasers, and this can get confusing. But this is one where we poke a very tiny microscopic hole in the iris, the colored part of the eye. You're not going to see it when you look in the mirror. And during the surgery itself, it is one of the procedures where most people do feel something. It's kind of like a flicking sensation, almost like a rubber band's kind of flicking you. It is very tolerable, but it only lasts about a minute. It's pretty quick. There's a risk of a little bit of bleeding, small chance of an eye pressure jump, and we watch everybody for that. But very well tolerated in-office procedure that you don't have restrictions for afterwards. It's difficult to explain in layman's terms exactly how this works without getting too complicated, but having that little hole in the iris significantly lowers the risk of that angle closure condition I described earlier, where the pressure shoots really high and you get the headache, nausea, and blurry vision. So think of it as a protective procedure. It's not to help you see better, but it's to help protect the eye so you don't have to worry about that condition. It is possible to have that little hole be healed in by your body over time, so we have to watch to make sure the hole stays open. So technically, cataract surgery is a more definitive procedure for this, but they're both treatment options if you meet the criteria where we need to address the narrow angle. So hopefully that's helpful, and let me know if you have further questions.